What are some things that affect a woman's cycle apart from the PMS? So, of course, it's a result of the whole cycle. However, what are some contributions to hormonal changes in women? As we talked previously, in men, it's quite stable throughout the whole time. However, in females, because of our menstrual cycle, it can change a lot. So our bodies are quite different, sometimes even dramatically, depends on the female and the male as well, because men have also dysregulations in, dopamine systems and serotonins, etc. However, I'm talking more about the menstrual and sexual cycle of female and male individuals. So what else is affecting us? It could be diet. So it's so important to keep on top of a good diet, and there's plenty of different advice on the internet when it comes to this. Just a balanced diet with not too much carbs and sugar would be really good. However, there's some sources saying that before the menstrual cycle and during the menstrual cycle, there should be a little bit more carbs and more regularity in having meals, because the body just needs extra support during that time. Whereas the rest of the time, you could do, for example, fasting as well, which is fine. It's more like closely related to male cycle as well. After the menstruation, usually you have more energy. There's a spike in testosterone in females after the menstruation too. Exercising is a big thing, so make sure that you get enough of physical activity in, because it's just emotion regulation, body regulation is just wonderful for you. Breathing, relaxation exercises as well. It's in general keeping in good health that will help you out to keep on track. So if, let's say, you had some stress at work, maybe some recreational drug use, or there's problems in a relationship, in any part of your life, this could potentially affect your menstrual cycle. Or STIs. If, for example, you've had any fungal infection or some viral infection happening to your body, or especially down there, if you've experienced something like that, perhaps just be aware that that could potentially change your cycle a little bit. So some women would experience more or longer symptoms before getting a period, for example. So just make sure that you stay on top of what's happening with my body, what could be the potential thing that affected, because a lot of people would just get, oh my God, what's happening? Why am I so emotional? Why am I not having my period? Is this pregnancy? What's going on? So to stop that kind of blow up, just keep in mind, okay, look, this happened. Perhaps I didn't exercise enough. I had a lot of stress at work. I had an STI recently, or maybe I went out one too many times this week, and there was too much going on inside of my body because of the alcohol or some drugs intake. So just keep that in mind, and maybe this way it will help you to calm down a little bit if your cycle is out of balance. I know it can be very upsetting. Your hormones can be all over the place, but just remember that you're not just by yourself with that. A lot of females are struggling with similar symptoms. So perhaps just visit a GP or a gynecologist if you're very much afraid and you haven't had any checkups recently. Maybe there's something bigger going on. So make sure that you ask for a comprehensive checkup. And even maybe asking for further checkup, because there are some STIs that actually professionals do not test for because they are rare, but they do happen. So if you're having some unexplained long-term thrashes, something going on with the mood, changes in the cycle, maybe that would be worth it to ask them to test for everything in everything that they could possibly do for you to test for it.